Well, I was quite lucky to have a GP placement in the first year of GP training, which is the ST1 year. So I came to my new practice. I was quite excited because it was the first time I've done general practice. My trainer was fantastic. I spent a couple of days shadowing all the different members of the general practice, so the secretaries, the pharmacists, the other GPs, learning about different styles of consultation. All the practice was very welcoming, had some excellent teaching, one-to-one teaching from my trainer, and I really enjoyed it. It was a very good welcome to general practice. Well, I saw my first patient in the second week of general practice, and it was a very different experience from seeing patients in hospital settings, because patients are much more well, and it's much less formal, and it was just nice to see the patient, although a bit daunting, but I knew I had my trainer in the next door room if I had any questions, if I needed any advice. And it was always nice when patients come back and see you again, and you can see how they're getting on and see the follow-up. So that was all very rewarding.
My first post was in psychiatry, so not in general practice, and actually away from the hospital setting as well, out in a community team. So it was a very useful job for GP training, but it felt quite detached from general practice really, and I think when you start general practice training, for some people it's a long time before they're going to do a post in general practice, and it's important not to lose heart, and sometimes it feels just like a continuation of being a foundation doctor really, just going around lots of different specialties, but you have to remember that you're ultimately going to be a GP, and that's what we're sort of working towards. When you start in general practice, you can usually expect to have 2 or 3 weeks of sitting in with other members of the team, all the other doctors and the nurses and even the receptionists, to get a feel for what everybody does. So usually it's 3 or 4 weeks before you start to have surgeries, and then you just have to leap in feet first really, and you'll have very long appointments to begin with, and there'll be somebody on hand to sort of speak to you after you've seen the patient to make sure that they're happy that everything you're doing is safe and sensible before they leave the building.
First experience of being a GP registrar was quite a gentle introduction. We had a really good induction programme, so I spent a few weeks sitting in with the other GPs and watching how they consulted, and picking out things that I thought went really well, and I suppose seeing people who are kind of quite inspirational and saying actually that's how I'd like to be when I'm fully qualified, but at the same time being quite daunted and thinking, by the end of this year, am I going to be able to see a patient in 10 minutes and fit all the things in that they do? Because at the time you have a very long time to see your patients, and that obviously gradually comes down as you reach the period when you're going to be let loose as a fully qualified GP.